How is limb-girdle muscular dystrophy diagnosed? Imagine trying to solve a puzzle where the pieces are hidden in different places. That's what diagnosing limb-girdle muscular dystrophy involves. It starts with a detailed look at your medical history and your family's health. Doctors ask about when symptoms began, how muscle weakness shows up, and if anyone else in your family has similar issues. They focus on muscles around the hips and shoulders because these are usually affected first. During the physical exam, the doctor checks muscle strength, looks for signs of muscle wasting, and notes how weakness spreads. This helps tell if the problem is truly muscle-related or caused by nerves. Next, blood tests are done to measure levels of an enzyme called creatine kinase. When muscles are damaged, this enzyme leaks into the blood, so high levels suggest muscle injury. But elevated creatine kinase alone doesn't tell us which type of muscular dystrophy is present. To get more detailed, doctors may perform electromyography, which records electrical signals in muscles. This test helps distinguish muscle disease from nerve problems by showing how muscles respond to electrical stimulation. A muscle biopsy is often part of the process. A small piece of muscle is surgically taken out and examined under a microscope. This reveals changes in muscle fibers that are typical of muscular dystrophy. Sometimes, biochemical tests on the biopsy can identify specific protein deficiencies linked to certain types of limb-girdle muscular dystrophy. However, in recent years, genetic testing has become the main tool for diagnosis. Using advanced techniques like next-generation sequencing, doctors analyze your DNA to find mutations in genes known to cause limb-girdle muscular dystrophy. This helps confirm the diagnosis and identify the exact subtype. Additional tests might include heart and lung function assessments because some forms of limb-girdle muscular dystrophy can affect these organs. For example, an echocardiogram or pulmonary function test may be recommended. The entire process follows a logical sequence, starting with clinical evaluation and laboratory tests, then moving to genetic analysis. Sometimes, if genetic testing doesn't give clear answers, muscle biopsy remains valuable. Early and accurate diagnosis is essential for planning treatment, managing symptoms, and providing genetic counseling. In summary, diagnosing limb-girdle muscular dystrophy involves a combination of medical history, physical exam, blood enzyme tests, electrical muscle studies, muscle tissue analysis, and increasingly, genetic testing. This comprehensive approach helps healthcare professionals understand the specific cause of muscle weakness, differentiate it from other muscle disorders, and guide appropriate care. Always remember, if you suspect muscle weakness or have concerns, consulting a healthcare professional is the best step to get personalized advice and accurate diagnosis.